our numbers in Thailand, it's a continual question of why are our numbers so low?
Yeah, look, I think everything about this virus is new, and that's one of the most extraordinary aspects of it as a subject for journalists to report. Almost everything else we've ever reported, if you think about wars, natural disasters, political crises, any kind of social developments, you've got quite a lot of dependable information. You've got a lot of other examples which you can use as parallels. So in general, you can combine the information you find out in the course of your work together with a great deal of background to come up with a pretty reliable assessment of what's going on. It's really different with this virus. It's fascinating. I mean, getting beyond the horrible impact it's having on all of our lives, to have a subject where even the experts often don't know. When it comes to Thailand, the one thing we do know is that the numbers are very low here, impressively low. We only had lower than single figures, lower than 10 in the last few days. And, the government is very pleased about that. And certainly it took some good measures initially. People were very tuned in to how serious this virus was very early on. Thailand has a relatively effective health system. All of those have helped. But the fact is, right across Southeast Asia, even in countries like Indonesia, where they haven't been anything like as effective, their own officials privately say they did pretty much everything wrong. They've got a huge population. Even there, their numbers, even allowing for the fact they're probably bigger than the official ones, are much, much lower than we've seen in the States and in Europe. And we just don't really know why. It could be weather, could be many other things. So, we're seeing official numbers, we're seeing developments in this story, but there's still a great deal we don't really understand.
And we've been out the last week in Thailand, so we've seen people who are been lining up at food banks. And so maybe talk a bit about that, about what's going on with the economics of Thailand and how people are getting through this time.
Yeah, I think that's one area where I think Thailand is quite a good example for the rest of the world to look at, because we've been so focused on the virus and what you have to do to curb it, and our real fear. I mean, it kills people. It's knocked out economies and societies. For the moment, everybody is focused on just dealing with the immediate impact of the virus and staying safe and adapting to the new way we're having to live. But in huge parts of the world, lockdowns have, a far worse effect than they have even in very advanced industrialized societies, because so many people have casual incomes, casual jobs, very, very marginal incomes too. They live day to day. They have no savings. We've seen that in Thailand. It's quite surprising. This country is not categorized as a poor country anymore. Actually, if you look at the World Bank figures, Thailand is judged to be on the cusp of becoming an upper income country. It has spectacularly eradicated poverty. In recent years, we've had completely full employment. Almost everybody who wants a job can get it. You do see poverty here, but nothing like the scale you see it even in places like the Philippines nearby. And yet, once this crisis hit, you've got millions and millions of people whose jobs just evaporated overnight and who are really struggling. And I think, we've been out to see that. It's been amazing to see these great long food queues, to see how many people are donating food, how big the need is, the incredible scenes where people went to the finance ministry because they hadn't been eligible for the government's cash handout. 28 million people applied for that cash handout. That's something like 75% of the working population. That gives you an idea how big the pressures are. And I think that raises a different issue that is not having to be addressed quite so acutely in places like Europe and the United States, which is when your COVID numbers are really low, and you've kept them really low, and the economic hardship, the impact is so dire that it probably has its own negative health outcomes. Governments here probably need to be making different calculations about the risk of COVID breaking out versus the damage done to their economies. And many governments are kind of more or less, you look at Indonesia, saying, frankly, we cannot have complete lockdowns. If we have a complete lockdown, we just fall apart. We have to be softer in our approach and allow for more infections than people are doing in Europe.
So you've been working in this industry for a long time. You ever seen anything like this?
That's an interesting one. I haven't. I don't think anybody has. First of all, it's completely global. We've got the same story in every country where my colleagues are based, of course, with huge variations. But the fact is, it is the only story in every place where the BBC has a bureau. Whereas normally you've got a huge diversity of stories coming from around the world. It's knocked everything else off the news agenda, but it's also crippled the way in which we work. Even in dire war zones, we usually find a way to get in. There's a few parts of the world that we've always found very, very difficult. North Korea, obviously, you only get in there with sort of, on government trips. Some wars are extremely challenging and do require massive amounts of planning and minimal numbers of teams going in. But for all of that, to have a situation where the health requirements and the safety requirements mean that you just can't travel for a start. You can't. In Thailand, it's difficult even to travel between provinces. When you go out, you've got to keep your distance from the people you're interviewing. You've got to do more and more on screen rather than going out face to face, which we all prefer. You get much more from people meeting them face to face. So the way in which we're having to work and the sheer universality of this story and the fact that it affects all of us. I mean, some of my colleagues are writing not about covering people with COVID-19, but about their own infections. Some of them have been really ill. So it's a quite unique story, that, in the fact that we're all sharing this same problem.
And you were around for SARS. In the beginning, did you feel like this was going to be something like SARS? It would start, then it would disappear, or did it feel different?
Because all these things always start with very little information. I mean, one thing people forget about SARS is that there were reports of these deaths in southern China going around actually for months before we really started getting a sense of it, before the infections really took off in places like Hong Kong. And at that time, China was more secretive than it has been this time. That the gap between the first infections, we think, and them finally coming clean about what was going on was much, much longer. By the time it took off, very quickly, I mean, it was very unnerving that the death rate was very high. But quite quickly, it became clear that it was not spreading that quickly. Now, when this one started, the only information we had was from coming out of China, but it very quickly became very alarming. Even in January, we were getting reports of huge numbers of people queuing up in hospitals, of doctors being overwhelmed, and you had Wuhan completely shut down. There was a sense then that this was going to be different. And once we started seeing spikes in infections outside China, and we started getting better information about just how badly impacted the Chinese health system was in the areas where the outbreaks were big, it was definitely a different kind of a disease. At that stage, still, you couldn't be too sure. Was it going to spread all over the world? Was it going to completely shut down economies? It was a possibility. You could see it was a possibility. But lots of stories we've had. SARS, I think, at one point, there was a possibility, a worry about it spreading, but it didn't last very long. It was fairly early on, once we heard about the disease, that we realized whilst it was having very bad outcomes for those who were infected, it wasn't spreading that easily.